Osteoporosis is a condition characterized by a decrease in the density of bone, decreasing its strength and resulting in fragile bones. Osteoporosis literally leads to the abnormally porous bone that is compressible, like a sponge. This disorder of the skeleton weakens the bone and results in frequent fractures, breaks, in the bones. Osteopenia, by definition, is a condition of bone that is slightly less dense than normal bone but not to the degree of bone in osteoporosis. Normal bone is composed of protein, collagen, and calcium, all of which give bone its strength. Bones that are affected by osteoporosis can break, fracture, with relatively minor injuries that normally would not cause a bone to fracture. The fracture can be either in the form of cracking, as in a hip fracture, or collapsing, as in a compression fracture of the vertebrae of the spine. The spine, hips, ribs, and wrists are common areas of bone fractures from osteoporosis, although osteoporosis-related fractures can occur in almost any skeletal bone. What are osteoporosis symptoms and signs? Osteoporosis can be present without any symptoms for decades because osteoporosis doesn't cause symptoms until bone breaks, fractures. Moreover, some osteoporotic fractures may escape detection for years when they do not cause symptoms. Therefore, patients may not be aware of their osteoporosis until they suffer a painful fracture. The symptom associated with osteoporotic fractures usually is pain. The location of the pain depends on the location of the fracture. The symptoms of osteoporosis in men are similar to the symptoms of osteoporosis in women. Fractures of the spine can cause severe, band-like, pain that radiates from the back to the sides of the body. Over the years, repeated spinal fractures can lead to chronic lower back pain as well as loss of height and/or curving of the spine due to collapse of the vertebrae. The collapse gives individuals a hunched back appearance of the upper back, often called a dowager hump, because it commonly is seen in elderly women. A fracture that occurs during the course of normal activity is called a minimal trauma, or stress fracture. For example, some patients with osteoporosis develop stress fractures of the feet while walking or stepping off a curb. Hip fractures typically occur as a result of a fall. With osteoporosis, hip fractures can occur as a result of trivial slip and fall accidents. Hip fractures also may heal slowly or poorly after surgical repair because of poor healing of the bone. Osteoporotic bone fractures are responsible for considerable pain, decreased quality of life, lost workdays, and disability. Up to 30% of patients suffering a hip fracture will require long-term nursing home care. Elderly patients can develop pneumonia and blood clots in the leg veins that can travel to the lungs due to prolonged bed rest after the hip fracture. Osteoporosis has even been linked with an increased risk of death. Some 20% of women with a hip fracture will die in the subsequent year as an indirect result of the fracture. In addition, once a person has experienced a spine fracture due to osteoporosis, he or she is at very high risk of suffering another such fracture in the near future. About 20% of postmenopausal women who experience a vertebral fracture will suffer a new vertebral fracture of bone in the following year. For more details, please visit our website and link in the description. Thanks for watching this video.